One of the real pressure areas within the NHS and within cancer, specifically within the NHS, is skin cancer. It's a very high volume specialty in terms of referrals, with numbers as high as sort of 500,000 referrals a year. And in terms of specialists, there just aren't enough dermatology consultants. And there's been a lot of different models and implementations that have been cited in a way to try and improve the whole pathway. And teledermatology, again, it's not new, but really a whole systems integrated implementation of teledermatology is something that I think is fairly innovative, and that's what we're really looking to tackle. So our PathPoint eDerma system is already being used by a number of secondary care trusts to manage their dermatology referrals. And essentially what it means is a nurse or a suitably trained healthcare professional can take some imaging, collect some basic clinical information from a patient, and then that be triaged by a specialist with the appropriate next step, which would either be being able to make a diagnosis solely based on that image and information alone, or recommending the next course of action, which is a small surgical procedure, usually a biopsy. One of the key components of the funding is to allow that integration between primary and secondary care, and the timing is very apt with the configuration of the integrated care systems, which this is naturally going to happen anyway. And rather than having lots of fragmented services, we want the secondary care providers to take ownership of all the referrals, and from the community side then have a fully integrated service that runs all the way through. And really what this project is allowing us to springboard it is to evaluate that in a real world setting at scale across multiple geographies. So we're doing this across 3 or 4 different cancer alliances with different implementation models. The nice thing about our technology is it's a pathway management system. So the clinical pathway doesn't have to be configured to how the technology works. It's very much the other way around. The system defined, by the system I'm saying the integrated care system, or the providers define their clinical pathways, and the technology is configured to enable that to happen. The management office has been fantastically helpful. They've really been more than just a funding mechanism, and there's a lot of additional value add that we're seeing. So they've helped broker a lot of connections. They've helped troubleshoot with some technical issues we've had by in bringing the right people in on the NHS and infrastructure side, and giving us contacts on that front. They've helped us improve visibility of what we're doing in terms of the project. We've been invited to speak at a number of events that again I think has yielded real benefits. They've shown the system and the NHS as a whole the innovations that are coming through, allowing them to plan and giving people foresight, because now when we go to talk to areas to say we're working on this project that we think would be great for you to be a part of, they already know about it, that they have an understanding. And I think working with the SBRI program, that's been sort of something that's been really refreshing, that it's been more than just a sort of funding and project mechanism. It's been actually a bit more of a collaboration and partnership. In terms of results we've seen thus far, we normally see about 30 to 40% of patients having a diagnosis straight away. So, the dermatologist sees the picture and says, this is not skin cancer, it's nothing to worry about, you don't need any further tests. And in the other 50%, then they say, actually, this is sufficiently worrying enough that we need to do the next stage of testing, which is a biopsy. So there's actually no need to just come for a face-to-face appointment. Now, the real value and the benefit that brings is that whole process is, for the dermatology consultant, is now 5 minutes, whereas before a face-to-face appointment was 20 minutes. So you're increasing the capacity of that specialist by 4 times. And there are lots of other secondary benefits as a system, as a whole system, because you're upskilling and uptraining other professionals and getting people to really perform at the top of their band and their skill set. So by employing a whole systems transformation, we're looking to really streamline the whole end-to-end diagnostic journey and reduce the skin cancer diagnostic pathway up to about 10 days. We think we can save about 10 days, and that's what some of the early pilot data has shown. And the one key sort of innovation and intervention is we're moving that photography and information gathering component from the secondary care setting right out into the community. In particular, we're setting these community diagnostic centres up in areas of need where they may have gaps in service. There are particular issues around health inequalities. We're also aiming to really help the NHS tackle the net zero agenda by, again, geographically spacing them out so patients aren't travelling 2 hours to see a dermatologist for 20 minutes. They can go to their local community diagnostic centre to have that imaging. So there's a whole range of secondary benefits and areas and problems that we're looking to tackle as well.